Did you know that colon cancer is the third most common cancer worldwide? And it's the second leading cause of cancer death in the United States. But here's some hopeful news. Early detection can truly save lives. Many of us might not think about colon cancer until it affects someone we know. But being aware of its symptoms is crucial, especially as we grow older. Today, I'm going to share some vital signs of colon cancer that are often overlooked. Whether for yourself or someone you love, knowing these could be a lifesaver. Colon cancer often sneaks up silently, showing little to no symptoms in its early stages. This stealthy nature makes it even more critical to recognize the warning signs as soon as they appear. As we age, our risk of developing colon cancer increases, particularly after 50. Family history and lifestyle choices like diet and activity level can also play significant roles. That's why staying informed and vigilant is imperative for all of us in this age group. Let's dive into the signs that should prompt us to consult a healthcare provider. Number 1. Changes in bowel habits. Understanding what constitutes normal bowel habits is essential because variations can signal changes in health, including potential warning signs of colon cancer. Typically, normal bowel habits range from 3 times a day to 3 times a week. This varies greatly from person to person depending on diet, lifestyle, and health conditions. However, any persistent change in your bowel habits, such as diarrhea or constipation that lasts for more than a few days, could be an early warning sign of colon cancer. Diarrhea, characterized by loose, watery stools occurring more frequently than your usual pattern, can indicate the presence of an issue if it persists. Similarly, constipation involves fewer bowel movements than normal or stools that are hard, dry, or difficult to pass. Both can be signs that something might be obstructing or affecting the colon. In addition to frequency changes, you should also watch for changes in the consistency, shape, or color of your stool. A significant and sustained alteration in the appearance of your bowel movements should not be ignored. For instance, narrower than usual stools can be a sign of a blockage in the colon. It's crucial to not just note these changes, but to act on them if they persist. If you experience any significant alterations in your bowel habits that last more than a few days, it is vital to consult a healthcare provider. This is particularly important if these changes are accompanied by other symptoms like abdominal pain, blood in the stool, or unexplained weight loss. Discussing these changes with your doctor can lead to early detection and intervention, which can be crucial in effectively managing health issues such as colon cancer. Number 2, blood in stool. Blood in the stool is a significant symptom that should never be ignored, as it can be a sign of various health conditions, including colon cancer. Blood can appear in several forms and colors, which can provide clues about the source of bleeding. Bright red blood typically indicates bleeding from the lower part of the digestive tract, such as the rectum or anus. It may be seen on the toilet paper after wiping or coating the stool itself. This type of bleeding can often be associated with hemorrhoids, which are swollen blood vessels in the rectal area that can be painful and lead to bleeding during bowel movements. On the other hand, very dark, almost black stools, known medically as melena, suggest bleeding from higher up in the digestive tract. This blood has been digested as it passes through the intestines and has a tar-like appearance. It can be a sign of more serious conditions, including ulcers or cancer in the stomach or small intestines. While hemorrhoids are a common and relatively benign cause of blood in the stool, they should not be dismissed without proper evaluation. The presence of hemorrhoids can sometimes obscure more serious conditions like colon cancer. Therefore, any occurrence of blood in the stool, whether bright red or dark, should be discussed with a healthcare provider. It's crucial for individuals to report this symptom to their doctor, who can perform the necessary examinations and tests, such as a colonoscopy, to determine the exact cause of the bleeding. Ignoring this symptom can delay the diagnosis of potentially serious conditions, including colon cancer, where early detection is key to effective treatment and better outcomes. Number 3, abdominal pain or discomfort. Abdominal pain or discomfort is a common issue that many people experience. However, certain types of pain and symptoms can be indicative of more serious health concerns, including colon cancer. It's important to pay attention to your body and note any new, worsening, or persistent symptoms. Concerning types of abdominal discomfort include persistent cramping, ongoing gas, and sharp or localized pain. Persistent cramping that doesn't go away with typical remedies, like changes in diet or over-the-counter medications, can be a red flag. This type of cramping can feel like a constant dull ache, and it might be accompanied by bloating. Excessive gas, while often related to diet, can also be a sign of a blockage or disruption in the colon if it is persistent and unusual for your normal patterns. This might also be accompanied by a feeling of fullness or swelling in the abdomen. Sharp or localized pain, particularly if it's in a specific area, can indicate something more serious. Such pain might be acute and can signal that there is a blockage or inflammation in the colon. Unlike diffuse pain, which might be felt over a large area, localized pain points more precisely to where the problem might exist in the digestive tract. If you experience any of these types of pain, especially if the pain is new, has worsened, or is localized, it's crucial to consult a healthcare provider. New or worsening abdominal pain should never be ignored, as these could be signs of conditions like colon cancer. A doctor can assess your symptoms and may recommend diagnostic tests such as imaging studies or a colonoscopy to determine the cause and ensure appropriate treatment. Prompt consultation and intervention are key to addressing potential issues effectively and can lead to better health outcomes. Number 4, unexplained weight loss. Unexplained weight loss is a symptom that can be concerning, especially when it occurs without changes in diet or exercise habits. Losing weight without trying might initially seem pleasing or harmless, but it can be a sign of underlying health issues, including serious conditions like colon cancer. In the context of colon cancer, unexplained weight loss may occur because the cancer affects the body's ability to absorb nutrients properly. The tumor might also create a systemic inflammatory response that increases metabolic rate, leading to weight loss. Furthermore, if a tumor in the colon is large enough, it could partially block the intestine, affecting food passage and digestion, contributing to weight loss. Health professionals often consider unexplained weight loss to be clinically significant when an individual loses more than 5% of their body weight over a period of 6 months or less, without a noticeable reason. For example, if a person weighing 200 pounds loses 10 pounds or more without any change in their eating or exercise habits, this would be a significant and concerning weight loss. If you notice that you or someone you know is experiencing this kind of unexplained weight loss, it's important to take it seriously and consult a healthcare provider. A doctor can evaluate these symptoms and may conduct various tests, such as blood tests, imaging studies, and possibly a colonoscopy to determine the cause of the weight loss. Recognizing and addressing unexplained weight loss early can be crucial for identifying and treating underlying conditions, including colon cancer. Early diagnosis often leads to more effective treatment options and better overall outcomes. Therefore, never dismiss unexplained weight loss and see a healthcare professional to ensure that any serious health issues are addressed promptly. Number 5, feeling of incompleteness. The feeling of incompleteness, or the sensation that the bowel does not empty fully after a bowel movement, is a symptom that can be both uncomfortable and indicative of underlying health issues, including colon cancer. This sensation, medically referred to as tenesmus, involves a persistent urge to defecate, but with little to no stool passed. It's an important symptom to note because it can suggest the presence of a mass or growth in the colon that interferes with the normal passage of stool. In the context of colon cancer, a tumor within the colon can obstruct part of the bowel, making it difficult for stool to pass through completely. This obstruction can lead to a feeling of incomplete evacuation. The tumor might also cause inflammation and swelling in the surrounding areas of the colon, further contributing to this sensation. If you experience persistent feelings of incompleteness, it's advisable to keep a detailed diary of your bowel habits, documenting the frequency, nature of the bowel movements, any associated symptoms, like changes in stool color or shape, presence of blood or unusual pain, and the persistence of the sensation of incompleteness can provide valuable information to your healthcare provider. This diary should include notes on what you eat, as diet can influence bowel habits, and any other symptoms you might experience. Sharing this diary with your healthcare provider can help in the diagnostic process. It allows your doctor to see patterns that might not be evident without detailed tracking, and it can aid in deciding if further tests, such as a colonoscopy, are necessary. Early detection of issues like colon cancer significantly enhances treatment efficacy and outcome. So it's important to consult a healthcare professional if you notice persistent changes in your bowel habits. Number 6, fatigue or weakness. Persistent fatigue or weakness can often be dismissed as a normal part of aging or a busy lifestyle. However, when this fatigue is unexplained and prolonged, it could be a warning sign of underlying health issues, including colon cancer. In the context of colon cancer, fatigue may be caused by hidden blood loss, which can lead to anemia, a condition in which the body lacks enough healthy red blood cells to carry adequate oxygen to its tissues. When colon cancer leads to bleeding within the gastrointestinal tract, the blood loss might not always be visible in the stool, especially if it is minor. Over time, this chronic blood loss can deplete the body's iron stores, resulting in iron deficiency anemia. This type of anemia can manifest as fatigue, weakness, and other related symptoms such as pale skin and shortness of breath. These symptoms occur because the body's organs and muscles are not receiving the oxygen they need to function properly. If you are experiencing persistent fatigue or weakness, along with other symptoms like pale skin or difficulty breathing, it is crucial to seek medical advice. These signs, especially when they occur together, warrant a thorough checkup to determine their cause. During a medical evaluation, your healthcare provider may perform blood tests to check for anemia and suggest diagnostic tests, like a colonoscopy, to investigate further if there is a suspicion of colon cancer. Detecting colon cancer early can significantly improve the effectiveness of treatment and increase the chances of a positive outcome. Therefore, do not overlook symptoms like unexplained fatigue or weakness, particularly if they persist or are accompanied by other concerning signs. Listening to your body and recognizing early signs can be key in addressing health issues promptly. If you experience symptoms like changes in bowel habits, blood in your stool, unexplained weight loss, persistent abdominal pain, a feeling of incomplete bowel emptying, or unusual fatigue, it's crucial to consult a healthcare provider. Additionally, regular screening, such as colonoscopies, becomes increasingly important after the age of 50. These screenings can detect colon cancer early when treatment is most effective. Don't hesitate. Taking action on these symptoms and undergoing regular checkups can safeguard your health and potentially save your life. Take good care of your health, stay informed, and don't hesitate to seek help when something feels off. If you found this information helpful, please consider subscribing for more insightful health tips. Together, let's stay vigilant and proactive in maintaining our well-being. Thank you for watching and take care.